Hi guys, Dr. Nick here. So today I just want to explain a simple rule that can help us understand how medications kind of work in terms of the pharmacology, from pharmaceutical medication to more basically homeopathic medications. So this rule is called the Arndt-Schulz rule. So simply put, there's three kind of components to this. At small dosages, a substance can stimulate. At moderate dosages, a substance can inhibit. And at large dosages, a substance can suppress or stop or even cause death of the physiological processes. So just giving some examples of this rule in action. So one example would be cortisone. So very high doses of that can actually cause death in some people, or even tissue damage, if you want to call it that too. And then, but at moderate doses, we know that it's utilized either to inhibit inflammatory reaction in the body, so or suppress the immune system. So that's what it can do. But then also inversely, in physiological doses, this is down to like 10 to the negative 4 to the negative 6 amounts. It has an inverse reaction where it's more, it can stimulate different reactions in the body, because we need cortisol physiologically to do many different things in the body. As we know, it's our stress response hormone. Another example of this rule when we're talking about it is alcohol. I think a lot of people can understand that, so that it, in large doses acutely can cause death. In moderate doses, it can kind of create a dysphoria, it can create kind of a wooziness, and it can create even a more even sleepiness. But then at low doses, it can also be stimulating in a sense. And then looking at the other level of it in terms of even botanicals, so you can think of Arnica montana. It's a great botanical for many reasons, but at high doses, it's very toxic to the body. And then at moderate doses, we even know that some of the key active ingredients have this inflammatory effect on the tissues when you put them, or especially the mucous membranes. But at low dosages, when we're looking at it at small dosages, it has an inverse effect, where we see from even research, these active ingredients now are able to actually have an anti-inflammatory, anti-rheumatic, anti-arthritic effect on the body, and that's why we use it in terms of homeopathic amounts, or even in creams for that joint pain or bruises or whatever it is. So you can see that this rule really plays a big, helps us understand things in a better way in terms of how doses really do play a true role, and how the effect of that compound or that medicine can be utilized. So the reason I wanted to bring this up in terms of this rule is because it helps us understand the kind of effects different doses can have on the body, from the pharmaceutical effect to the homeopathic. And it hopefully gives you a better understanding of maybe how these low doses in homeopathy can actually have a physiological effect on the body and create that therapeutic response. So example in terms of even what I utilize in practice is homotoxicology, the homeopathic medicines, but also from the fact of LDI, low dose immunotherapy, where we're using lower doses or concentrations of these kind of substances, and they're creating this physiological reaction in the body. So I hope you understand that. I hope you enjoyed that. Continue to follow me so you can learn about new things that I come up with in new videos. Again, thanks for watching.